Hello, my name is Davina Hope DeBolt, but I prefer to be called Hope. I am 27 years old. I live in Dallas, Georgia, with my 4-year-old daughter, my mother, and my 5-year-old lab mix. I am currently in the process of buying my first home in Villarica, Georgia. I am a registered nurse. I graduated from Rasmussen College in Ocala, Florida in March of 2015. Since May of 2015, I have worked at a psychiatric residential treatment facility for children, and we specialize in autism spectrum disorder and pervasive developmental disorder. Prior to being a registered nurse, I was a psychology major. I have always known that I would end up working in the psychiatric field in some capacity. I became interested in psychiatry as a young teenager when I went through a rough time of my own. I was involuntarily hospitalized twice, once for self injury and once for suicide attempt. I engaged in self injurious behavior for 4 years. Relationships with my family and friends suffered, and I even almost dropped out of high school. Um, I had to attend a private school that was a work at your own pace program. The silver lining to this is that I graduated high school a year early because I was motivated to be done and get out of that environment. I underwent 4 years of psychiatric treatment and various medication trials attempting to treat my mental illness. My diagnosis went from major depressive disorder to generalized anxiety disorder until they finally settled on what they called neurotic depression. This diagnosis has since been renamed in the Diagnostic and Statistical Manual 5 to persistent depressive disorder or dysthymia. This basically means that the depression lasted for longer than 2 years, with brief, shorter than 2 months at a time, periods of alleviated mood. Because I know how it feels to be depressed, I became interested in helping others, especially adolescents, who are enduring psychiatric illnesses. As an adult, I have not engaged in self injury or had a severe depressive episode resulting in a suicide attempt. I do live with a low grade, bad mood, or sad mood most of the time. My depression has continued to affect me. If you will notice, I'm 27 years old and just graduated with an associate degree in nursing at 26. A poor focus and a lack of motivation have been adverse effects for me as a result of this illness. For 14 years, this has been my baseline. I do function normally in society. I do have a healthy relationship with my daughter, and we enjoy our time spent together. I'm no longer on antidepressants and have learned to manage my reaction to my moods without medication. A major factor in this has been that I was uninsured or underinsured for the majority of my adult life until now. And this is why, in the 2 future installments entitled You Should Know About This and You Should Care About This, I will be discussing insurance coverage for mental health care. Thank you.